Hello, my name is Katie Parker. I am an emergency room nurse at Virginia Beach General Hospital. I am a trauma nurse. We are going to discuss some ethical issues that come into play as a nurse, and in different nursing fields come with different issues. Some of our issues in the emergency room are DNR patients who the families did not present a DNR on field with these patients, and they come in and we continue to work these patients because they are in cardiac arrest, and we want to do our best to save their lives, not knowing that they have a DNR. So when we are presented with the DNR and we've had return of spontaneous circulation, do we then cease any efforts to continue to keep these patients alive? Because their prognosis is very grim, and we are keeping them alive with medications like Levophed and vasopressor. And so this is a difficult issue sometimes with these patients because families have a hard time deciding, but yet we have to follow through with these patients' wishes that they signed a DNR. Some of the other issues is blood draws for intoxicated patients or suspected of being intoxicated. Fortunately, we have a great working environment with our police department and the precinct, our local precinct, and the police don't put us in these situations where we have to make a decision whether this is ethical or unethical. Usually, we both pretty much can consent to whether the patient has a legal capacity consent because they can understand, or they can't and they subpoena our records. One of our biggest issues, though, is our psychiatric population patients. We see the most psychiatric patients in our city and region. We also have a locked psych safety psych pod in our unit because of that issue. These patients can come in sometimes as a ECO, meaning an emergency custody order, meaning they're at risk for their harming themselves, at risk for harming others, or acutely psychotic and cannot make capacity to consent to treatment. These patients usually refuse to come to the hospital, and that's when police get involved and become an ECO. For the patients who can consent to treatment but refuse to, our suicidal population, or patients who maybe have some mental health issues but not necessarily acutely psychotic where they don't have capacity, our issue as nurses come into play with our doctors who feel sometimes that these patients don't have the right to consent and cannot refuse to have their labs drawn or their urine sample obtained. We need to have labs and we need to have urine in order to medically clear these patients to go to psychiatric facilities. If they refuse, then they end up going to a state facility, which is a long process, and we really don't want them going to state facilities because therefore usually the criminally insane and more psychiatric patients. However, that's where they do go if they refuse. But they do have that right to refuse. And according to the right to self-discrimination provision 1.4, as nurses, we have that right we have to honor our patients and make sure they have the capacity to consent for treatment. If they have the capacity to consent for treatment, we do not have a right to touch these patients, and we have to make that clear with some of our doctors at times that put us in a difficult situation where they're demanding we do these procedures to patients when we know that they have the facility to consent. And if they absolutely refuse, then we do not have the right to touch them as an emergency custody order patient. Just because they're emergency custody, that is for psychiatric treatment. That is not for medical treatment. Now, if we feel that they have overdosed or there is a medical issue going on that we need to treat them for, then our doctors can call the magistrate and obtain a medical TDO, and we have had to do that at times. Usually these patients need a lot of trust, so provision 1.2 is relationship with patients, honoring our patient choices, which go along with this as well, that they choose not to have these procedures done with us, and therefore that is their right. And as nurses, we need to be able to put our foot down and make sure that their rights are not violated just because a doctor is ordering us as nurses to do this. This is a tricky population. There's always a lot of black. It's not always black and white. It is very gray area with these patients, and it really puts nurses in an ethical dilemma on how to treat these patients at times. So I hope this was helpful in learning somewhat about the psychiatric population, which is a huge problem in our country and a broken system that needs a lot of repair and fixing. Thank you, and have a good evening.